first personal computer I bought, 286K memory, IBM 55. I paid $5,000 for it. I thought I was so cool. So suddenly, you've got the Gen Xers coming back, and they're seen as an everyday necessity. Because of the move of technology and the pace of change, Gen Xers are looking at technology saying, wait a minute, this is what we need. They grew up with ATMs, they grew up with everything. I mean, the idea of controlling their lives. And millennials, even worse. How many of you are Star Trek fans? The Borg. Perfect example of the millennials. There's your definition. Okay, for those of you that don't get the joke, the Borg is an enemy in Star Trek where their names are given up and they become one of 36. The community is everything. They're 5 of 14. It's all about the connection. And that's really where the millennials are with their technology, is that they've understood that the technology can keep them connected at all times. Now, the interesting thing for healthcare here is that you look at the pace of change of technology. Now, just very quickly, think about this. The time it took to get to 50 million users for radio, 38 years. Television, 13 years. The internet, 4 years. iPod, 3 years. Facebook, anyone want to guess? 9 months, 100 million users. The pace of technology is advancing so rapidly that it's going to overwhelm us. And yet, as Michael Porter mentioned, 85% of the physicians out there still use paper and pencil. They still don't have electronic medical records. I had a dinner 4 years ago, sitting down with the then president of AMA, and he said, there's not a patient out there that wants electronic medical record exchange. Not one. Nobody wants their medical information exchanged. I looked down the table and said, let me introduce you to one. If I'm going to be in an emergency room, I want people to know my medical history. So you can see the differences in the generations and how they're coming at this. So, healthcare, how do they look at it? The generations look at it very differently. Our system has basically been built, our healthcare system as it exists today, has been built for the greatest generation. And it's all about direct me. Give me the direction. I believe in institutions. I believe in credentials. I want the doctor to tell me what to do. Boomers say, no, no, no. I want to be engaged. I want to know what my options are. Tell me what's going on. Great Pew study talks about the internet usage and the fact that more and more people are looking for alternative care on the internet. Now almost 45% of all adult users of the internet are exploring healthcare alternatives. If we look at the Gen Xers, it's all about educate me. When we did our study of Gen X mothers, the number one thing they asked for, give me an otoscope and teach me how to use it. Educate me. I know from the sound of the cry when my child has an ear infection. I can see a bunch of heads nodding in the back. They know it. And all they want to know is that, is it more serious? So they want to be educated. They want to be that self-sufficiency. The millennials are all about connect me. It's all about connection. Look at the difference in the expectations of the people using the healthcare system. How different it is. Now, the greatest generation, we asked people in our study for Minute Clinic, we asked them to draw the healthcare system as they saw it. Greatest generation, patient-doctor, they see the doctor as the gatekeeper. They look to the doctor to provide this buffer between all of the other elements of the healthcare system. And the information flow is one way. Now, contrast that with baby boomers. Still about the patient and physician, interestingly, but the baby boomers come with a lot more influences. They're looking at the internet. They've got disease management. They're looking at their payers and employers. They're looking at health clubs. They're getting input about disease and conditions. I mean, I've talked to physicians. They'll tell you that a patient will walk in and say, 2 hours on the internet equals your 12 years of medical education. So it's a very different role, yet they still, boomers will tell you, they still look to the doc for direction. But now it's two-way. Engage me. I want to know what my alternatives are. I want to be able to talk about what we're doing. Now, what's interesting is if you come to the current generations, the millennials and Gen Xers, suddenly the picture changes completely. The patient is at the center of the universe. The physician, yes, still an important relationship, but now they're doing a context. It's about information flow. They see their data in every other aspect of their life being shared and accessible to them. They want those records. Now, what's interesting is you'll find a lot of people in the healthcare industry saying that the information belongs to the provider, but it's your health record. We have to change this. Gen Xers will tell you they expect technology to be a big part, not of the science of technology, but the delivery. I want to be able to make appointments online. I want to be able to get test results back. I want to be able to communicate. I want to ask my doc questions over email. The big deal is for them to create self-sufficiency. So when they draw it, you start to see things like the internet searches, the Google, PHRs, all of these other influences, in many ways on equal footing as the relationship with their physicians. Very different. Now you can start to understand why physicians, healthcare systems have to change the way they're looking at it. The expectations of the consumers, the patients themselves, are very different. And this is one place I will disagree with Dr. Porter in that he had up on there that the consumers can't fix this dysfunctional system. I look out here and say, we are all consumers of the healthcare system. Yes, we can fix it. We can, as employers, as buyers, as users of the healthcare system, we can force the system to change. Now, our goal was to focus on those last group. We understood that our target audience was all about the millennials and the Gen Xers. So what we did was we designed the system to be focused on a specific set of services, a very narrow set of services: pharyngitis, sinusitis, ear infections, things that ruined your weekend. I mean, you know what it's like. You've got the weekend all planned. Friday night you go to bed. Saturday morning you hear, "Mom, I don't feel good." And it's like, good God, now what do I do? Now, some of you are blessed. You have pediatricians that have hours on the weekend. Great. Most people don't. So what we did was we created a system that would give them access when and where they needed it. So it was all about putting healthcare delivered in a retail environment. It was all about giving them the confidence that they needed to be able to come in and feel the relief that we could provide. The second piece was we staffed it for delivery. Now, what's interesting to me is if you look at medical education, physicians are dealing with death on a regular basis. And so they're taught to remove themselves, which is an important part of their education. I understand that. But that's the marginal area. What we needed was an emotional connection. We had people telling us that they wanted to make an emotional connection with their provider. So they talked about nurse practitioners who are taught to make that emotional connection. It was also a cheaper way to do it. You know, the reality is our healthcare system's based on a system of triage that was established during the Korean War. Remember MASH? The idea of mobile hospitals, Army hospitals, was created where the most advanced surgeon was the first person that a wounded soldier saw when they came in. Because it was a life and death decision. They needed to understand this one and this one, their wounds look the same, but my assessment is this one's not going to make it. I can save this one. We're going to have to make that one comfortable, let them die, and we're going to save this one. So the triage started with the most successful or most skilled individual. What we have to do is we have to reverse that. And we did that with MinuteClinic. We established the nurse practitioner as the first line of interaction. The last thing was really developing technology. The other thing about medical education that concerns me is that we teach our doctors that everything should be kept in their head. And yet we have technology that can feed them answers. It's smart technology that can learn and help them make better decisions. Think of it if you got on a commercial airliner you know that that pilot has tens of thousands of hours in the cockpit, in trainers, going through simulations, and yet the first thing they do is pull out a checklist and go through a specific checklist. Not to replace their judgment, but to know where to place their judgment. So at MinuteClinic, we did the same thing. We created algorithmic decision tools that help the provider understand the diagnosis based on the symptoms and the information the patient was providing. The other piece was everything was electronic medical records. So we started from scratch. There were no paper records in MinuteClinic. Everything was electronic, and we were able to provide a summary of the visit to every primary provider. So if you came into a clinic, we'd ask you who your primary provider was, and we would then send them a summary of the visit to ensure that the record was complete. We also had electronic medical records because if you happened to be in Orlando on vacation and you lived in New York and your child gets sick, you could go to a MinuteClinic and they'd have access to the child's records in Orlando because everything was centrally located. So how did we do? Well, these are the satisfaction numbers. We asked every patient as they left to give us some feedback, to provide us with 2 measurements that we brought from retail. When you're in a retail business, you really want to know, are you satisfied with your visit, and will you refer or recommend us to someone else? I mean, that's what it's all about, is getting people to feel good about the experience they had. You can see from the numbers, these were unbelievable satisfaction numbers. I mean, virtually 100% satisfaction and almost 100% likely to refer. Now, I came up out of Procter & Gamble, PepsiCo, Arby's. I've never seen numbers this strong. The next piece is really about culture. We created a culture at MinuteClinic to encourage innovation. And the first thing that I was very clear about was, I'm not there to lead innovation. And if any of you think you're here to lead innovation, let me correct you. Leaders do not lead innovation. Leaders have to facilitate it. Because as a leader, if you step up and say, I'm going to lead innovation, what will happen is you're the only one that's going to be inputting. It'll impinge on everyone else's input. So the first thing I want you to understand is really understanding the facilitation process, because the goal is all about getting people to understand what you're trying to innovate about, have a desire, but most importantly, have a confidence that they can offer innovation. Because not every innovation, not every idea is going to be a good one. Unfortunately, the reality is that most of the environments that we work in today stifle innovation. There's too much hierarchy. There's not enough communication. There's not enough exchange. So how do you change it? Well, the first thing I would say that you have to do is make sure that everyone understands what you're trying to innovate and why. We were very clear we were going to redefine healthcare delivery in America. Then you have to have a mechanism to capture this creativity, to provide an area that you can grow possibilities. The third piece is really creating a web of communication, because it's not just about the specific planned, innovative interactions. I mean, how many of you have been kind of wrestling with a problem and you're standing in the shower washing your hair and all of a sudden, oh, I got it. And there has to be this ability to share communication. You know, you have to be able to engage the people who are serving your customers on an everyday basis. The fourth piece is really to encourage people to understand their gifts. And this is where I think we as leaders in business today fail probably the most. And the 4 generations are going to make it even tougher to do. We have to understand, we have to get people to understand, they come to an organization with a very different, very specific set of gifts that they need to use. Experiences, perspective, thought processes that you want them to use. So how did we do it at MinuteClinic? Well, the first thing was the clarity of purpose. We made sure